Hey guys, today is September 18th. I had my surgery yesterday for my spinal cord stimulator upgrade. And so everything went good. I had to wait 4 hours to 4.5 hours, I think it was, to actually go into surgery. But you know, things happen with the surgeons and everybody's different. The patients, they don't know what they're getting into until they do. Um, so basically, what they did, for those who are interested, is the spinal cord stimulator. What it does is, depending on where your injury is in your body, they put like a paddle or two leads along your spinal cord. And how far up and how low it is depends on that injury. Mine are my feet, so the leads are probably maybe a quarter or a third the way up my spine. Uh, So the leads hook underneath your skin into this computer slash battery uh, um, thing object, and it's placed under your fat in your hip. Uh, Mine's in my right hip buttocks area, so it's right above the meaty part of my buttocks where the fatty part is. And they need that fat because you don't want to, because you have a charger for that battery. You don't want to place that on straight on the computer itself. They said they want a little fat there to cushion it so that it can, I don't know, but that's what they said. I guess that justifies some fat, huh? But so what happened is mine was, I got that in 2010, so it was 8 years old. And when I went to start using it when I was going back to the gym, it was burning and not holding the charge. So they upgraded it. Now my new one has a lot more ways of stopping the pain to my brain. And the old one was just pulse sensation. I could control how much one foot was with another compared to another. So I had some control. I had 4 programs they programmed for me. And what they did is they woke me up during surgery and they started playing with it and told, they asked me what felt better, and he would program 4 programs, and then I could work with it inside those programs. So anyway, so that I went in and everything went good. He had to cut out some scar tissue, which 8 years, of course. And so when I came out last night out of the anesthesia, when they actually woke me up, I was out of there within 10-15 minutes. I mean, I was awake. The doctor came, and I remember him talking to me, and he started to walk away, and I had another question, and he talked to me. And I said, I'm ready to dress. If I can go, I'm ready to go. She goes, oh, if you feel like it, yeah. I mean, when I got up, I was a little dizzy, but I mean, other than that, we were home. We were home. I mean, within probably 25 minutes of me coming out of the anesthesia, of me when they woke me up. Of course, I wasn't coming out of the anesthesia right then and there, but uh, anyway, the worst thing for me was last night was my throat. And I've talked about how I've just been recently diagnosed with severe apnea, and that my doctor thinks it's because my throat is swollen, and it could be the allergies that's caused it to swell. Well, I think they had a hard time getting the tube down my throat because I've never had any problems with my throat after anesthesia. So I guarantee they probably had a hard time, as sore as it feels, and it feels sore right in that area where it closes off, where I can't breathe. So I was drinking. I had Tony make me. Now listen to this. I did good. When I got home, I was really hungry, and because of the sore throat, you can't. I thought I wanted something cold. So Tony went to the store. No, before Tony went to the store, I had her make me my morning shake, which was, I've already talked about this. My salad in a shake slash fruit, and I drank that, and it felt so good. And then she went to the store, and while she was at the store, I was sitting there with my throat, thinking, man, what else could cool down my throat? And so I had her pick up some gelato ice cream. And it it was funny because when she got back, by the time she got back, I was like past that stage, and she showed me what flavor she picked up. I said, okay, that's okay. And then I sat and thought about the rest of the night, and I thought, I don't really want it. No, I'm not gonna. I don't want to sit and eat that, you know. And so today, when I got up, well, when I got, I'll finish this story. And when I got up this morning, of course, it's on the back of your mind because that's the addiction, right? And I made my shake, and I was drinking my shake, and I thought, oh, this isn't sweet enough. And it just amazes me how your mind goes with, you know, you've got that in the back of your mind, and you start doing a mental trip on things around you, or what you're trying to do different or be good at. And so by me shaking my shake, I was being good, right? And I drank it and stuff. And when I was making it, I had to pull the fruit out of the freezer. I like my fruit frozen, and I saw the ice cream there, and I thought, you know, I don't really want that. I mean, I didn't really have a desire to eat it. And and then as I'm sitting here handling some paperwork, I started thinking about the ice cream again. I thought, no, you know what? I don't think I really want that. And it wasn't that I need it, but last night when I asked her to get me some, in my mind, it wasn't that I needed it. I thought it was just a cooling and what I would enjoy. I'll be honest with you. So far, where I'm at now, because I'm talking about this because of the shift. I'm thinking she's got to go to her mom's tomorrow. If I haven't touched it by tomorrow, I'm going to have her just give it to her mom. Uh, I'm doing pretty good though. But last night I had a good night's sleep. I was worried about being able to lay in the bed because the first time I had it, oh my God, the burning I had. I couldn't even lay back. But the scar tissue, and it's already got a pocket, so I thought, well, I'll lay in the bed. I'll sleep in the bed if I can lay down and put the CPAP on, and then I'll just roll on my left side. I can't lay on my left side a lot because I've done something to my left shoulder, and I'm not sure what it is. Uh, anyway, I won't go into that. I think I already did. But I found myself, I slowly shifted over to my right side, and I could lay on my right side. So I slept. I woke up one time around 1. I think it was because of the CPAP. I think I turned it off and turned it back on. And then I got up. Excuse me. Always happens on the video. I got up about 4:30 this morning. Felt awake, didn't feel sleepy, didn't have any pain. My throat was better. The only thing is it's just a little scratchy, and it's left me a little hoarse. But other than that, the surgery went good, and I've walked around. I'm doing normal things. I have no restrictions except for I can't bend over a lot. I try to limit my bending because he doesn't want it moving. He wants it to adhere. I do have to wear a binder, an abdominal binder. And doesn't that bring back some emotional trauma? But not only that, it itches my belly. I'm probably going to get all the hair rubbed off on my belly from this. And I have to wear it 6 weeks for that little battery, and I'm like, I didn't have to do that on the first one, but of course, things always change. They find new ways. He wants it to adhere really good. Well, Tony said he told her, I don't have to sleep in it after last night. That'll be nice. Unless it does protect my, adds more padding to my back, to the area, I will wear it at night. But I thought when it gets to the point where I can't wear it, I'll take a break from it off and on and wear it most of the day. But I'm thinking, I can't wear my jeans over this. I mean, right now my jeans are already tight. It's just like, man, I have to wear my big people shorts. And I'm just thinking, well, you know what? This week doesn't matter anyway because I'm not doing anything. I hired a woman out at the stables to clean our pens this week. Tony can go back on the weekend and do it. But I asked her if she would do it, and I gave her some money, and she said she'd be glad to do that for us. She's a nice woman. She's actually retired and disabled too, but she's Boy, she's out there riding a horse every day. I gotta hand it to her. But anyway, so let me talk about the experience at the hospital as far as being transgender. So this hospital, San Joaquin Community Hospital, has done a lot of has put a lot of energy into connecting with the LGBT community and how to improve their services for us as a minority judgment for us as a minority group who's judged constantly. And for the past few couple years, one of our advocates is the one that works with San Joaquin and Kaiser really close. And she has, of course, we've known each other for years because of the LGBT community, and she has requested a few times for my input, and I did a questionnaire for her for San Joaquin Hospital for how would trans patients feel, should they place them in a room with the same biological gender, or how would, or should, not biological, they never asked that. They asked if they should just make a room, a private room for transgender. And basically I said it really is, depends on the transgender person and where they are in transition and how they feel. I said, as far as me, I would rather be in, I'd be in a room with another guy. It wouldn't bother me, you know. But that's a one-to-one, you know. And I know hospitals don't have a lot of private rooms, so sometimes I feel if you set that up and give options, of course, anybody's going to take a private room. But so I did a questionnaire like that, and then recently she's had some more questions. So she has just recently, in fact, she asked me some question, or I had a question, and she found out through her connections to San Joaquin what they were doing. So when I was being pre-admitted for my pre-op stuff, everything went fine. Didn't make any extra facial expression towards the gender identity. I think Kaiser's using gender identity transition or something like that as a diagnosis for their medical, because they have to have that, because it, well, anyway, they have to have that on there because that's what they're treating us for as far as hormones and surgeries. So pre-op went good. When I got to the labs and doing everything, when I actually got to the pre-op room yesterday, the nurse assistant was doing all that she did, and when she saw the scar on my arm, she goes, "Ooh, what happened?" I said, "Oh, I had a surgery." "Oh, what kind?" I said, "Phalloplasty." And granted, you're only separated, the area is probably 6 feet wide, and then you've got curtains and people next to you on down, and I had men on each side of me. And she goes, "Oh, what is that?" I said, I'm transgender, and it's a gender reassignment surgery. She still did not understand, but she said, "Oh, okay." And I said, "Well, if you have any questions, I'd be happy to ask." "Oh, no, I don't have any questions." Okay. Well, then the nurse who came in to do my IV and stuff and go through all my history and stuff, she saw the scar, and she goes, "Oh, what's that from?" And I said, "Phalloplasty." And then she said it after me, like she's trying to know what that is. I said, "Gender reassignment surgery." Oh, and then she taps my arm like, "I'm sorry." But later, when she asked me if I had any other implants except for my battery and my penile implant, so she kind of understood but doesn't probably understand. And I said, "No, there's no other implants." And the penile implant was my erection device rod, actually, and the testicles. So, yeah. Anyway, that was my experience there, but it did make me anxious because I had to speak up, you know, a little bit louder the second time I had to answer a different way. And so I did consult my to-go person, my friend who is an advocate, the advocate, and talked about that. Now, Kaiser, I don't know how many watch my channels that has the opportunity to have Kaiser. But, you know, there's war stories with every doctor, every insurance company, and Kaiser has done so much for my wife and I. I cannot tell you how they expedited Tony's uh, medical treatment when she was diagnosed with cancer. I mean, we were in the surgeon's office discussing it within 2 days. She was in surgery within a week. From the time they diagnosed it to the time she went into surgery and the biopsy, doing the biopsy, from the time she did the mammogram to the time she did the biopsy to the time she met the surgeon to the time she had surgery was 15 days. Yeah. They have always been good to us. Of course, I've had the endo issues with them, and I've had to go switch out twice, 3 times. Well, I'm on my third endo, but because of hormonal, you know, they're too conservative, and you know, that's the only issues we've had. All the surgeries, the phalloplasty, everything was good. I did have an issue with the nurse who coordinated the trans surgeries in the beginning. She was very like I can't explain that personality, and you guys might know the word, but she was like, well, you know, if I asked a question like, oh, that's when I was having endo questions, um, can I get a second opinion? And who would I go to? Because we only had one endo where I live. And so when she came back to give me the information, she said, you know, your surgery hasn't been approved yet. So that's more or less like threaten me not to stir any trouble because they haven't approved it. I'm like, oh. So after I got done with all my surgeries and stuff, I wrote a big old grievance against her. I don't know what happened with her. She's no longer in that, but I'm not sure it's because of me. But I've had other guys say stuff about her, and I told them, report it. People don't know, administration doesn't know, superiors don't know unless you report it. So remember that. But for you guys who can have the opportunity to have Kaiser, go for it. They're just, it's so much hassle free. You know, you go within the network. They've got modern facilities. If they don't have it, they contract. It's just a great thing. But I want to do this update real quick just to let you know I've gotten through the surgery and I'm on the mends. And yeah, if you have any questions about spinal cord stimulators or chronic pain, let me know, or anything. I'm here. So just let me know. Make a comment, and I'll respond to you as soon as I can. Okay, take it one day at a time, and always make your journey as simple as possible. We'll talk to you later. Bye.